in case someone else. There we go. We're not official yet. It's still 2 minutes away from 11:30. And I see Rick is on here, so he's going to be part of the presentation about housing through you, Ann. Oh, and John is the other person that's participating.
Good morning.
Good morning. So for everyone coming on, please just make sure the name shows your first and last name. So we have that for our record when we do minutes. Alan, I'll change yours.
Oh, thank you. I don't know how to do it, so I can.
That's okay. For you, for those joining us, we're just waiting another couple minutes until we have a few other of our regulars come online.
Is Corey, is Dane going to be available?
I believe so. He didn't tell me he wouldn't make it. So he should be here. Does anyone need closed captionings turned on? Does that help anyone?
I'd like to give it another minute if we can to make sure that our first point update person.
Okay. For the name on here that says J. Andrew, can you please add your first name?
Where would I go to do that?
When you hover over your box, the little dots should show up to the right of the word mute. If you click 3 dots, you'll have a pop-up menu, and then just click rename, and then you should be able to add it. Did that show up for you?
No.
Okay. Is this Jim or
Yeah.
who's? Okay.
Yeah, Jim Andrews.
Okay, I'll see if I can do it for you.
Okay. Thank you.
I got it. All right, thank you. Appreciate you being on here.
You're welcome.
If everybody's ready, we'll go ahead and call the meeting to order. It's 11:31 according to my computer, my time watch here. So thank you everyone for coming to our meeting. We missed last month because of other things going on, but I'm happy to see people here that are here. And we'll start it up at our September meeting of the Public Safety Coordinating Council Subcommittee on Housing and Behavioral Health. So I would like to have everybody introduce themselves because we have presenters on here that don't necessarily come every time, and they'd probably like to know who's here. They know who they're presenting to. So I'd like to introduce everybody, and I'll start with what is on my screen. I'm Chairman Alan Hobson. I'm a member of the Winston City Council and the liaison to the LPSCC Winston. Jim Andrews, you introduce yourself.
Yep, I'm Jim Andrews. I'm the lieutenant for the Roseburg Area Command of Oregon State Police. And Our patrol area is basically all of Douglas County except for the part that extends from Elkton west on 38.
Thank you, Jim. Laura Coates.
Hi, can you hear me?
Yes.
Okay, perfect. My name is Laura, and I am the shelter support supervisor over here at the Gary Leaf Navigation Center.
Thank you, Laura.
Thanks.
Cecilia Lepler.
Morning. Sorry, I work with Pizza Home. I'm the health and housing coordinator, still learning about my position and happy to be here.
Cecilia. Janelle.
I'm Janelle Kohler, the Executive Director for the Housing Authority of Douglas County, and I also help facilitate the HTAG meetings, which is Homeless Transition Action Group, in addressing homeless issues in our community.
Teresa Roche. I assume that's how you spell your last name.
Yes, perfect.
Pronounce
Thank
your
you.
last name. Okay,
Yes.
thank you.
I'm with WorkSource, and we help people find jobs or careers. I think that's it.
Okay, thank you.
Thank you.
Wendy Lang.
Hello, Wendy Lang over here at the Douglas County Juvenile Department.
Thank you, Wendy. Dane Zonner.
Dean Zaner, he, him pronouns. I'm with HIV Alliance, and I also help facilitate with the connecting point, like collecting of the data and organizing some monthly meetings, just keep us on track.
Thank you, Dane. We'll hear from you in a little bit. Jesse Spain.
Yeah, my name's Jesse Spain. I'm the regional director for Painted Horse Recovery.
Thank you, Jesse.
everybody.
Maria Knight.
Good morning. I'm with Umpqua Health. I'm the Behavioral Health Operations Manager for Youth. And I've been here about 6 months.
Thank you, Maria. Trista.
Hi, everybody. Trista Saltikoff, the Executive Director for Chadwick Clubhouse.
And thank you, Trista. Jerry O'Sullivan.
I'm Jerry O'Sullivan, Chief of Regional Business Operations for ADAPT.
Thank you, Jerry. Cheryl McDonald.
I am Cheryl. I'm the Crisis Program Director for ADAPT.
Thank you, Cheryl. Robert Wilson.
Hello, Robert Wilson. I'm with Douglas County Circuit Court. I coordinate with the Mental Health Court, aid and assist, and cover for drug court when needed.
Thank you, Robert. Emma Dugan.
Hi, I'm Emma Dugan. I am the Forensic Mental Health Services Supervisor at ADAPT.
Very good. Debbie Hollander.
Debbie Hollander, and I'm the Community Engagement Coordinator for Umpqua Health.
Okay, my computer keeps jumping around here, so if I miss somebody, let me know. Ellen Noah.
Ellen Noah with the Juvenile Department.
Thank you, Ellen. Marion Pearson.
Hi, Marion Pearson, Coordinator of the Douglas County Human Trafficking Task Force and Program Manager for Violence Prevention Programs at Mercy Foundation.
Okay. So I know that we have three of our presenters when our community presentations come up. It's from UCAN. We have Rick Sapp, Julia Anselmo, and John Dizerud. Is that correct, John?
That's correct.
Thank you. So that's our presenters coming on later on, and we will get back to them later on. So thank everyone for showing up and not introducing yourselves. Next is our approval of the minutes from July 22nd. Do I have a motion to approve the minutes?
How about a motion to approve the minutes?
Thank you, Dane. Do I have a second?
I'll second.
Thank you, Janelle. Dane and Janelle have moved and seconded to approve the minutes from July 22nd. All in favor, either raise their hand or say aye. Anybody opposed? I see no opposing, so the motion passes. Okay, Dane, do you have updates for the connecting point?
Sure. Let me share my screen and I'll show you a picture. Unless Corey, I don't have sharing capabilities, so I can just go verbally through it.
If you click something, does it say asking for permission. I don't see anything popping up.
Yeah, I
Oh,
just
there
sent
we
you a
go.
request. There you go.
Okay, should work now.
Awesome. Thank you so much, Corey. Well, in August, we're a month behind usually on our data, just so you know. But the connecting point, we did update the format of this a little bit so that people can identify what agencies. Not all those agencies are represented at every single time, but where we're going, the program locations like the Dream Center, Seventh-day Adventist Church, the opioid treatment program, Winston. We're using South River. We're looking in Winston at maybe a new location, Myrtle Creek, the Harvest Christian Church, Drain, Living Hope. The Myrtle Creek and Drain are once a month. Then Sutherland, we go to Hastings Village, and we did start a Reedsport one this summer. Served 286 people, 144 males, 142 females. Not provided just means nobody identified outside of male or female. Age groups, we did get age from some of them. 84 people identified age, so 36, 18 to 30. 31 to 50 was 38, and then 51 to 64, 10 people. We had nobody identify over 65 this month. We did have a gap in our identifiers, and so we only identified, we have a, like I'm M66ZA, and we only had 18 people selected, so 10 were male, 8 were female, and then unduplicated. I believe that includes, I'm not sure why that number, I will have to get back to you. That should be 18 also, because we had 10 male and 7. And then the shower trailer, we served 130 people. I was able to unduplicate that, 89 unduplicated number on that. And then kind of our top services like food and water were number 1 this time, 185 people. Wound care kits, always up there in the top. And then malicious resources, Adapt does a lot of like bags, pens, just flyers, and it's 148 people were reached with those. The lock zone, really impressed with that. It might have had, overdose risk has increased, especially in September. 118 naloxone, 53 condoms, hygiene kits 37. Harm reduction, of course, we do not do this on any city property in the city of Roseburg, and we work with different agencies on different levels of harm reduction, but we served 8 people. Fentanyl test kits, 6, and then socks, 4. Gaddis syringe. We didn't collect a whole lot of syringes. It's been a barrier, and people are telling us they're coming to the office instead. And we have seen a huge increase in September with the clients coming in. There was a gap in our syringe collection in August, and I think we saw that in the dynamics of a lot of our connecting point, just some drops in numbers in some of the areas. The Dream Center has been getting us our data, and they served 170 people with food and 123 people with clothing. But as mentioned, we did have some gaps with the ID collection. I'm working with the team to make sure they identify, if they can, that unduplicator, so we can kind of unduplicate that number. Corey's team was out in August and did a 600 medical bags at the outpatient treatment center. It was amazing. And then she was able to leave behind some of the supplies like gloves. She gave to the medical bus. 30 bags were given to the shower trailer. Jamie Diaz got some of the bags, 20 of them. And then she gave Carly some of those resources like the sanitizer wipes, Rob Gandy, some of the sanitizer wipes. But that was such a great, I love the core program and Corey getting those people out there. I think we got 2 things planned for October that she'll probably be talking about. But any questions on that? I think we're reaching a lot of people, and I know Corey, I think, sends us out. She probably sent our yearly recap because we're in the like 750 range. I'm going from memory last year of how many unduplicated people we served, which kind of gives you a number of how many unhoused. And then I know Rick's going to be presenting, so we've been trying to get the UCAN, how many people they've connected to housing during the month. And at the moment, I didn't have it. So I will fill that in, but I know Rick's probably going to talk about it.
Okay, thanks, Dane. That's a great report, and the fact that you're.
And we're trying. One of the things the Connecting Point team's trying to do is work with community leadership, and like it really takes the community partners, the community, and the community leaders to let the community members know these resources. Because like Winston's been a challenge, and we've been really trying to get more people, in a where they're residing. Most of these people are unsheltered, and so they get moved around a lot, and they're really trying to protect themselves. We think that's one of the pieces, but where Rob Gandy went through Winston and worked with a lot of the different community-based organizations, churches, just to connect with them and let them know what we're doing. And I think the two things that I would encourage from his information is, like, a lot of these agencies didn't even realize that the resource guide existed. And that is one amazing thing that's out there. And Corey is just, I always send people to LPSCC website, and it's like the link to the resource page and the connecting point flyer are both there. So easy to find. You can drop that in a chat, on a text to somebody, because my name's listed on the flyer, and all month long, I'll get people reaching out like, hey, where are you at today? You can drop that in there. But that resource guide is probably one of the most amazing things we have in our community. And so I would encourage, like, share that, have it out there, share it with others if you're tabling an event and such.
I agree about that resource guide, Dane, because I need to get some more of those. I've run out myself, and so I need to pick up some more there with our community.
So Dane, I pulled up your connecting point from 2024. Total service encounters, you had 2,273. Unduplicated people, you had 754 for the year.
Awesome. No, and I think it takes the effort of all these organizations that really gives you a number of, how many unsheltered people we have out there that need resources. And it's that's kind of presents how many open locations and housing we need in our community.
That's exactly right. Most of the problems with unhoused is because they just can't find housing that they can afford and that suits them. So that's always a burden. Thanks, Dane, for the report. And anybody else have any questions for Dane? Hey, thanks, Dane. So we'll move forward to our behavioral health updates. Adapt. Cheryl, do you have a report?
I do. And I am going to apologize in advance. I am sharing my office today with a litter of foster kittens from Saving Grace, and they're everywhere and they're really loud. So I'm so sorry. They're like knocking over plants and yeah. Okay, so I'm going to start with impacts. We saw a pretty big increase actually in our total cohort and the number of cohort members that are currently meeting that active criteria of 4 or more incarcerations within the previous calendar year. So our total cohort is up to 746 members, and 239 of those members are currently meeting that criteria. So previously we've only served about 150 to 170 cohort members at a time. And so I think it's really interesting because we also this quarter saw a small dip in the number of services that we're able to provide. And I think that's correlating to some decreased staffing at the jail, which is kind of leading to some scenarios where we can't always get in when we'd like to. But we're hopeful that jail staffing will increase and we'll be able to get in there and provide those services. So same types of services that we are typically providing, a lot of care coordination, really excellent coordination with jail staff, primary health care, mental health care, substance use treatment coordination, Social Security, housing applications, move-in deposits, rental assistance. We've been providing a number of rental assistance recently to cohort members, which have allowed them to stay stable in permanent housing. So that's been amazing. And we have an update with resolution rooms. The resolution rooms have had a total of 28 stays recently. We're still seeing a lot of individuals who are coming in for a variety of reasons. Most recently, there's been a number of individuals who had a domestic violence incident in the middle of the night and needed a safe place to stay. We're also seeing people who live outdoors. I think the Majority of the individuals that we're serving are actually without housing. So of those, it was 28 stays for 22 individuals. And of those 22 individuals, 17 of them were unhoused. I think what we found is that it's a really great solution for people living outside who have a court appearance or an appointment the next day, and they need some supports in being able to get to that appointment in a timely fashion. So that's been really beneficial. It's also been amazing as a bridge between those services. So seeing someone at Sobering Center, and there's a detox bed the next day. We just need to support them safely for a short period of time. Those have been really helpful. I have the latest set of mobile crisis statistics that I'll send out. And the state of Oregon, OHSU has been doing a really fantastic job. I send them my data and they send back these Douglas County specific, really this data story and pages of charts and graphs that'll break down exactly who we're responding to, the work that we're doing, the type of calls that were going on, and then the resolution of those calls. And then they send a second report that compares Douglas County to the rest of the state. And so we are consistently the second or third highest call volume in the state. And we had last quarter, we had 699 different calls for service. And about 100 of those were able to be resolved with a telephone call, but 593 of them required that in-person contact. So we have maintained our busyness. We have just hired a bunch of new staff, actually. So we've hired a new mobile crisis supervisor. And if you haven't met her yet, she will be making her rounds. Her name is Rachel. She just moved here from Texas, and she is just in the process of kind of getting acclimated to all of this. And then we've also hired, we increased our peer support positions. So we now have a total of 5 peer supports. And I don't want to knock on wood, but we officially filled our last open position yesterday. So we are fully staffed, which I think is really kind of a triumph for a mental health team in rural Oregon. So we have a lot of new faces coming on board, and our hope is that we're really beefing up. Instead of a 2-person team, most of the time we should have a 3-person team, which will allow for increased call volume and some flexibility in our calls. So I will send Corey both of those reports because I think they're really interesting to look at. And then our Sobering Center continues to have growth. We had 77 admissions over Q3. We do see a lot of frequent individuals still. We had one gentleman that had 18 admissions, and we are okay with that. We would prefer people to come to the Sobering Center rather than go to jail. We have the opportunity at the Sobering Center to have these recovery-based conversations and supports and options and develop that relationship with people. And we actually had a scenario recently where a former frequent service utilizer brought someone in as a voluntary admission as their sponsor. And so I think that these types of services, providing the service in a slightly different way, really works. And it's really amazing for us to be able to see that win when it happens. So I will send all of those numbers over to you, Corey.
Thank you, Cheryl. And Corey will send those out, right, Corey, to the
Yeah,
to the
I'll
group?
send out the follow-up email.
Okay, thank you. Any questions for Cheryl? Great number of. I'm just always amazed at the number of people that that adapt serves on a monthly or daily basis almost. So it's a great group out there. Thank you, Cheryl. So don't think Lindsay Holcomb is with us.
No, she was not able to come today.
So we won't have our Mercery Medical Center Behavioral Health Unit update today. Do we have any other behavioral health groups that have any updates that they would like to share with us?
So this is the time where Trista could say something if she has something, or Umpqua Health.
I kind of have something actually. So this is actually regarding transportation, and I'm actually working on trying to put together some kind of a group because of the transportation that's been cut to South County for people that are not able to access their mental health meetings because the bus routes have been cut. Also, UHA has cut funding to Chadwick Clubhouse as of October 1st. And so I am putting together, so Hyper Transport has 3 vehicles that they're willing to not donate, but donate their resources, donate the 3 vehicles if we can find volunteers, and maybe some kind of like he's trying to set up like a GoFundMe for any kind of volunteers that are willing to run these transports to South County to Winston and kind of cover that route to get them in for people that need mental health services that aren't able to access it down there at this point. We're trying to form some kind of a committee or group of people that are willing to participate in this. So he has got 3 good working vans at Hyper Transport. He's willing to help donate the gas, but we need community partners on board with either. I'm going to send out a blast email. I think I've got Corey, I've got Dane on there. I think I've got Janelle on there. If you guys can, if you want to be a part of it, send me your email address. I will put that in the blast email. You guys can send it out further. But we have a lot of people that are not able to access resources right now. I think probably 5 of our daily individuals are South County, also suicidal if they're not coming to Clubhouse, kind of critical things that are happening here by like tomorrow. Pete, the owner of Hyper Transport, has been willing to continue free services for Chadwick Clubhouse for a few weeks until we can get something in place. But if anybody has any ideas, if they want to be a part of it, if they have resources, please reach out to me. I'll put my email in the chat. I think that's all I have for right now.
Hey, thanks. Thank you, Trista. Is there anybody else that can with what Trista needs there? I know that the transportation is open to cover those routes, but they have no idea how long it's going to be before they cover those routes. And I know it's put a great damper on a lot of the South County people. Hopefully we can come up with a solution that will help at least alleviate some of the damage that's caused.
I know it's not just us. I know that there's other organizations that are and people that are going to feel the blow of this. So we're willing to try to figure out something.
Thank you, Trista. Anybody have any comments or questions? Go ahead, Jesse.
Yeah, so I'm kind of getting mixed information, one of the transport places said that they're no longer going to be able to assist in picking up clients and taking them to 12-step meetings. And then so I had my couple of my peers call another place and they're like, oh yeah, we're still doing that. So it's like, but one of the drivers told us last week, because he came by and he's like, yeah, this is the last week I'm going to be able to drop people off at these types of meetings. And so I'm just wondering like, what's really going on? Because I'm getting mixed information, but so.
Well, Bay Cities is kind of the hub for all of that. And I don't know, all of the little sub transportation businesses probably have mixed information. But if you guys really need to figure it out, give UHA a call and see if your specific program's still covered. And if not, reach out and we'll see if we can get connected with some transportation. So.
Okay. All right. Thank you.
Mhm.
Thank you, Jesse. Thank you, Trista. Anybody else have any questions or comments? Okay, any other, okay, I guess we'll move on to our housing updates then. Janelle, do you have any updates for us from housing?
Yeah, just briefly, Housing Authority, it's been business as usual. We're still not pulling from the Section 8 wait list, but we expect to around the beginning of the year. And then for HTAG, we're just working on refining our language and trying to have the most impact on addressing the unhoused and issues around that. It just seems like at any given time, one element to the problem as a whole gets emphasized, but there's so many moving parts and so many things to take into consideration. So we're continuing to work on the best way to be supportive to all of our community members, including the cities, and how to articulate that in a way that's going to be effective. So that's my updates.
So Janelle, is the housing shortage still a real bottleneck, or nothing else is opening up to speak of as far as group housings at all?
So as far as generally, we are having and seeing vacancies here and there. We are also, since we've made our applications more user-friendly, and we're getting a lot more people apply for all of our housing at once, even if they may not be as interested in a certain location. So what that does is when we do have a unit come open, it's taken quite a bit longer to fill it, due to the fact that we go through quite a few people that decline because either they've solved their housing crisis, or when they applied, they checked every box possible. And then when we have a unit come open in an outlying area, it may not be suitable for them at this point. So the point to that is we're going through quite a few applications to fill one unit, more so than I think we've seen in the past. In addition, there are vacancies. However, I think some of the issues here for us at the table is we're dealing with the harder to house individuals that aren't ready for traditional housing or in a space that they can be compliant with a lease agreement and such without a lot of supportive services around them. And so, housing, yes, gets brought up as we need more housing, which is true. However, there is housing openings out there on a regular basis, even in the private market, talking with some of our landlords that work with our Section 8 program. But again, this goes to the complexity of all the moving parts and some of the clientels that we're serving that have a lot of barriers and are not easy to house in a traditional housing environment. And so, a more complex answer to your simple question. Is there housing?
No.
Yes. Is it really suitable depending on the dynamics of who we're serving? Not always.
Yeah. Well, that's very, very understandable, and very low barrier housing is still hard to come by.
Yes, that is correct.
Any other questions for Janelle? Comments? Okay, any other housing updates around? We haven't put on our agenda, but any other housing updates for anybody that wants to comment on it?
Well, Ellen, if Laura's willing, we haven't had someone here from the navigation center in quite some time. So,
oh, yeah,
Laura, do you mind having do you have any information you want to share?
So I've been in this position, this is like going on my third week, and this is my first time in this group. But updates, well, we had the Adapt mobile clinic here yesterday. That was a huge success. I believe that they saw seven guests from the navigation center, and treated them as like walk-ins, that kind of thing. I also found out that it's not, when they're parked here at the navigation center, the second and fourth Monday of every month, it's not just for navigation center guests or patients, it's for walk-ins as well. So anyone from the community can come use those services. And yeah, I mean, our navigation center is full right now. We do have one person who's getting housed Friday, moving out. Yep, but besides that, we're just working on things as they come, trying to fix little issues here and there that we see. The navigation center is definitely a project right now, but I'm grateful to be a part of it and be in the position that I am.
Thank you, Laura. And do you still have is there a wait list for the
There
navigation?
is, yeah, there is a wait list. Last time I checked, it was just over 100 people long. So,
Ooh.
yeah.
Those
Yeah,
those
eventually we want to expand. That would be, I don't know. Jordan, the CEO, says many moons from now, but I mean, so we'll see. I hope to see that in the near future.
shows certainly shows the need for housing in
Absolutely, absolutely.
the need is there. It's just where it needs to happen is at home.
Mm-hmm. Yep.
Anybody else have any updates for us or any questions? And welcome, Laura, to our group.
Thomas had something. He's with Peace at Home.
I have an update on the youth housing campus out in East Roseburg next to Eastwood Park and Deer Creek Apartments that Peace at Home manages in partnership with FARA, Family Faith Relationship Advocates. Our units opened in April, and we still have availability for young adults who are looking for a short-term rental, like a 1 to 2 year rental. It's a subsidized rate that's below market, and we do prioritize those with a history of interpersonal violence or homelessness, but we have an available unit for an 18 to 24-year-old at this time. Also, the FARA Youth Crisis Shelter, because of some of the funding landscapes at this time, they're reprioritizing their activities for the remainder of the biennium. And the Youth Housing Crisis Shelter for those 12 to 17 is now not operating, but going to reopen as a transitional living and facility for those 18 to 24, but still will be a service for day drop-in for crisis services and the resource center for the clothing pantry for those K-12 type youth and their households. Any questions about what we call the Lotus Pad out in East Roseburg?
So the Lotus Pad, that's the one that is available for 1 to 2 years for renters for 18 to 24-year-olds.
Yeah, so we call the whole campus the Lotus Pad, and Peace at Home operates one of the houses on the property that's a 5-unit resident that's cut into a duplex. So there's a 3-unit and a 2-unit, and we still have one room available in the 3-unit apartment that's available for 18 to 24-year-old rent.
Okay. And what does it look like to get in there? What are the requirements briefly, or the things that would prevent them from getting approved?
We're wanting to be helpful with 18 to 24-year-olds, so we don't, we're wanting to be that first stop on rental history. We can help case manage. Cecilia's on this call here. She's a case manager, one of our healthcare advocates. So we can walk the young adult through the whole process. But it does require, I believe, a deposit and then a monthly rental.
Okay.
And I don't recall the exact amount. It's somewhere around $400, $500 a month, which is below market.
Awesome. Thank you.
Thank you.
Thank you, Thomas. Yeah, that age group is in definite need, no doubt about it. It's a valuable resource.
But yeah, you'll hear the Dome Spay project, or it's spelled Domespay is another way you'll see it. That will be now, I think, opening in just a couple weeks as a immediate drop-in transitional living program for 18 to 24-year-olds.
I might have somebody that's interested. What's the process? Just get a hold of somebody at Peace at Home?
For the Dome Spay project, I would get a hold of, I'll put her name and contact in the chat. They have a K-12 resource coordinator. Her name is Emily Lowry. She used to work at Casa de Belen. She's awesome. And she takes a text anytime and she can help. They have some direct assistance dollars as well, which of course will be short-lived this year, but just using it all up while we still have it. And she's the one that helps K-12 households best.
And this would be, well, the one I'm interested in is the Lotus House.
Yeah, I will then also put in the chat here Shelly Holt, who could be a great first stop on helping get a renter in the Lotus Pad.
Okay, thanks, Thomas.
And then, but otherwise, just call our public office and somebody like Cecilia will immediately take on the case.
Very good, Thomas. Thank you very much. Any other questions or comments for Thomas? Okay, and that's definitely a need, not only for the young adults, but even for those kids that are unfortunately moving from one household to the other, trying to stay with facility. Hey, unless we have any other roundtable updates, we'll go to community presentation for a UCAN agency overview. Who wants to start off? Is that Julia?
Yes, I'll go ahead and share my screen. Can you all see my full screen?
Yes.
Wonderful. Okay, well, thanks for having me. My name is Julia Anselmo. I am the Outreach and Engagement Specialist for UCAN. And I have an overview of our agency, United Community Action Network, that I will go through. So a little bit about us. We're a social service agency here in Douglas County, but we also cover, some of our programs cover Josephine, Klamath, and Lake counties as well. We provide about 13 different client-based services across these counties for low-income individuals and families. As you can see here, we have 6 different departments, all various focus areas from early learning, health and wellness, property services, housing, and engagement. And just wanted to highlight HRSN is a new program that UCAN now partners with UHA, specifically for OHP clients. And I just wanted to, due to the nature of this committee work, I wanted to highlight and bring in 2 of our staff here at UCAN that are part of the Department of Housing and Stabilization. So I'm gonna let them cover their programs, and then whatever time we have left together, I'm gonna briefly touch on our others. So just wanted to welcome in John to cover veteran services.
Hi, I'm John Disford. I'm the Veteran Services Supervisor here for UCAN. Really, what we do is we support military veteran households with our primary services, case management. And we work with households who are either in danger of losing their housing, so they're facing with an eviction within 30 days, or help unhoused military households seek housing. And we do that with the help of our landlord partnerships, property management partnerships. We work with the Veterans Affairs Program, OHCS, that we have 2 funding sources, Access and CAPO, and we partner with a ton of agencies in Josephine, Douglas, Klamath, and Lake County to assist our veteran households. And we help them navigate barriers, and we provide multiple different services to veterans. And Julie, if you can go to the next slide. So one thing that kind of gap in the services that we provide is emergency shelter to medically fragile veterans and families. We also provide emergency shelter with community partner referrals for veterans that you're working with, veteran households, so we can place them into hotel shelter for up to 60 days. And we work with a variety of hotels here in all 4 counties that we service, which is the main thing that we do is case management services. And this is really our primary focus is to work with our veteran households onto a path where they're stably housed and they're self-sufficient. But we do have some like temporary financial assistance that we offer which is help with deposits, like short-term financial assistance where we can pay rent, the full amount of the rent for like 6 to 9 months, as well as we have programs that can go up to 4 years where we're splitting the rent cost with the veteran household. Often one of the primary functions we also serve is to kind of mediate between landlords and veterans households. We go over the lease agreement with them, check in with the landlords each month, check in with the veterans each month, and make sure things are copacetic. And that has really been a great tool to keep people in permanent household housing. A great thing that we have is a legal services program. We work with an attorney firm called Northwest Veterans Law, which we can address everything from expungements to evictions to a whole lot of other services. Though of course they have to qualify for our program for that. We do provide transportation assistance, bus passes if needed, car repair, and also monetary assistance for childcare, basically. And there's some other sub-services we can provide to you. So referrals and partnerships, we primarily work with the veterans, the VA, but we work with other community partners from whether it's Easter Seals, mental health services, and we really work hard as income is an important part of being permanently housed and stably housed. So whether that's SNAP benefits, TANF, disability, employment, Social Security, there's some VA benefits available for them. So we're working with community partners on both attaining permanent housing and increasing income to support that permanent housing. And so really, who qualifies for our program is a person who served in the active military. So they need 1 day of military service. It doesn't matter what branch or length. And the only discharge status that would not be accepted into our program is if they were court-martialed and dishonorably discharged from the armed services. We do have some income restrictions, but it's 80% of the area median income. So it's pretty generous, and and they need to be either unhoused or at risk of losing their housing to qualify. And then being currently residing in Josephine, Douglas, Klamath, or Lake counties. So if they're a veteran and meet those criteria, we don't have a wait list. We're not allowed to have one. So anyone who qualifies, they're brought on and they start receiving case management. And so for our 4 counties, Josephine and Douglas County, we're servicing, and this was as of 2024, 83 veteran families. This number is absolutely up. I know we currently are actively servicing over 100 families at this moment, households at this moment. So I don't know what our whole year is, but definitely we've had a rise in who we're servicing in Josephine and Douglas County. But as of 2024, that was 83 families and 135 family members. And then in Klamath and Lake, we were servicing 53 veteran families and 87 family members. That's a little bit about what we're doing. It's a super exciting program. We're happy to do it, happy to serve our veterans in this way. If you guys have any questions, let us know.
Thank you, John. I'll pass it over to Rick.
Good afternoon, everybody. Hear me okay? Perfect. My name is Rick Sapp. I'm the Housing and Homeless Services Supervisor here in Douglas County. Talk to you a little bit about what housing is and what we do for homeless services. What is housing services? my housing team here in Douglas County consists of an eligibility coordinator, and I have 3 housing case managers. Keep in mind what I'm going to tell you is we operate here in Douglas and down in Josephine County. So our Josephine County team that's in Grants Pass has the same basic layout. Who we serve right now, we have several funding sources, wide range of people that we serve, anywhere from being that 30, 50, 80% AMI, referrals from community partners, qualified mental illness, referrals or currently engaged with drug and alcohol providers, street homeless or chronically homeless, under 250% of poverty, 58 or older, 14 days behind in your mortgage or your rent, single families, single fathers with kids, single mothers. What does eligibility do? If you receive an application and you're already housed, our eligibility worker will go through that application. They'll screen that application for every one of our 21 funding sources we have here in the housing department and see which one the client best fits. We have some long-term, short-term rental assistance programs. We have some one-time deposit type rental assistance programs. Once all the documentation and everything's submitted for the application for eligibility, once they're deemed eligible for a program, the file will be staffed with the entire team to decide the appropriate case manager to work with them to take the file over and just walk with the client, setting goals to self-sufficiency. Go ahead, Julia. Thanks. Case management's different with every program. Which funding source we're using, which program they're on. But the case manager will work with the client to help them find better jobs, higher income, working with DHS child welfare to reunification of families, drug and alcohol mental health providers. They'll work with getting folks on the Section 8 wait list. They'll educate the clients on landlord-tenant laws and fair housing laws. They'll work on life skills and they'll work on things to help them overcome barriers that may be impacting their housing stability. As well as the housing services, I also supervise our homeless outreach team. I have 2 homeless outreach coordinators that are out in the field every single day working with people right where they are. They do street outreach, and they'll work with those folks that are unhoused at connecting them to community partners to help with facilitate a need. They'll work with, we'll get referrals, help them work with landlords. They will hand out survival gear, tents, tarps, sleeping bags, support our extreme weather shelters, warming, cooling centers. They work with the Roseburg and Grants Pass Police Department and motel assistance when available. And the last thing I want to touch on is the annual point in time count. It is a date selected by HUD that we do a count of the individuals who are suffering from homelessness in all of Douglas County. This year, that event will be on Wednesday, January 28th. I will have, will be hosting an event at St. Joseph's from 10 to 3 on the day of PIT. We'll have community partners, food, cold weather gear, and stuff like that to invite the unhoused population to come in. We'll do a survey to document the number of individuals suffering from homelessness in Douglas County. They'll be doing the same thing in our Josephine County office. During that time, we'll have roving teams that are out and about as well, looking for folks unhoused. And, you know, getting these numbers back is really important, incredibly important for funding for our community. So I'll talk a little bit about our navigation center. Laura's here, so if you have any questions, she will be able to answer those for you. But the navigation center is a low barrier shelter per the OHCS guidelines. Clients work with case managers there to create goals and working on achieving them. Folks that stay there are asked to agree not to bring drugs, alcohol, THC, any paraphernalia on property. Engage with community partners that are there. Participate in cleaning up after themselves. Abide by the quiet time at 10 to 6 and be in by 10 p.m. unless you communicate that in advance. Online shelter supports, so there's staff there 24 hours a day to help the folks there. Folks that stay there, they have all the basic needs met: shower, laundry, kitchen appliances, building closet, 24-hour shelter staff to help them out. The guests there are served 3 meals a day. You can staff that's there are trained as peer supports, and the staff there just help folks navigate to self-sufficiency and long-term housing. The first client moved into the NAV Center in June of 22. With the NAV Center, aside from the overnight shelter for the folks that stay there, they do offer walk-in services. Some of those things that you can get in walk-in services are clothes, bus passes, hygiene kits, pet food, blankets, connected to community partners, and a place to just sit down and take a minute. All of those things are as supplies are available. Not all of those things are going to be on site all the time. Just some photos of setting up the tiny homes. So the NAV Center has a congregate shelter with beds inside in a congregate type setting, and then they have some of these tiny homes or mod pods out in the parking lot for guests to stay in.
Great. Thank you, Rick, for going over those 2 programs. Laura, I just wanted to invite you to share anything else if you wanted to touch on for the Navigation Center.
I mean, Rick pretty much covered everything there. And we're going through a little bit of a program manager change right now. The community partners, I've been reaching out to community partners and kind of, because they don't come to, there used to be community partners that came here like daily. We had a schedule when I first started working here, and somehow we've fallen away from that. So I am working on rebuilding that. I'm meeting with HIV Alliance this week actually to kind of figure out what that looks like and how we can better serve the guests. So that might look a little bit different here in the near future, but no, Rick did a really good job. Thank you for covering that.
Great. Okay, well, I want to be respectful of your all's time. I know that this committee comes to an end at 12:30, so maybe another time I can share a bit about all of our other programs, but for now I would like to open it up for questions on our housing department. We have somebody from a staff member from all of our programs, so.
Hey, it's a very good presentation. I have one question, Rick. On the point in time count, when you do the point in time count, as you meet with the people that are housed, do you ask how long they've been unhoused? I mean, other than the fact that they're unhoused, is there any question about how long they've been unhoused?
Can't hear you, Rick.
How about now?
Yeah.
There you go. Okay.
Perfect. So as far as the survey that we used during the point in time count to get the numbers for HUD, it doesn't have a length of homelessness in that. So the short answer to your question is no. At that data collection, we don't have a length of time that individuals are suffering from homelessness.
Okay. I was just curious about the how many of these individuals, are homeless year after year.
Rick, did you ever get your report for this year?
I have not seen the numbers yet. The estimated numbers that I saw were a little over 300, but I'm fairly confident that number isn't as high as it portrays, because we served 235 meals at the Pitt Count event last year. So, and with those numbers at the event last year, and what numbers were coming back from the roving teams that go out on the day of Pitt and try to interact with those folks that can't make it to the event, I would say those numbers are closer to 400 or 450, and that's in the county. So, but the accurate numbers from HUD I haven't seen yet.
Okay, thanks, Rick. Any other questions or comments from the UCAN group? A very great presentation. Very much. Go on to are there roundtable updates from anybody that wants to share anything? Or did you have something else? Okay. See, nobody raised their hand, I guess. Corey, do you have any comments?
Yeah, our next drug court graduation is going to be December 16 at the fairgrounds. Still working up a final flyer with the court coordinator on that. So once we have that, we'll get that out there. We have 7 people right now that are working on their community projects to graduate. And I'm meeting with one more person Thursday, and then I'll have all the flyers ready, and then we'll get the press releases going and get information out. So once I kind of want to wait to showcase what we have once I have all of them completely done. So definitely by the next meeting, but I can also send an email out in between with some of that. And then some new news. I don't know if you folks know who Dave Gramman is. Dave Gramman is our jail pastor. He does a lot of work with, he has True North Star Ministries. His son and daughter-in-law run the Roseburg Dream Center. So I'm working with Christy Gramman, his wife, and they used to do a community reinvestment summit. I think she said maybe even 10 years ago. And that's something they've wanted to bring back to the area. And when I went to a conference for one of my grants last December with our jail discharge planner, one of our things that we went through was a simulation. And that was something I came back real jazzed about, because we all on this call and all the other meetings I attend, we do so much for the community, and we help a lot of folks that are in need and struggling and unhoused, coming off of drugs or other things. And it was really interesting for me to kind of see more of their perspective. So yeah, we're helping them on one side, but it was nice going through the simulation to feel firsthand the struggle, the anxiety felt. Sometimes we felt like you were wronged with something because it's random cards. So an example, I went to the probation table. I pick up a card and it said, dirty UA. And he goes, well, I'm going to give you grace today. So I'm going to send you to your counselor to go see what the root of the issue is. So then I had to use a bus, and you had to use a bus ticket each time you went to a table. Then I went to my counseling table and it said I no-showed the appointment. Go see your parole officer. So I went back to the parole officer and he's like, well, I gave you grace, but you no-showed, so we're not getting anywhere. So you're going to go in jail. That's your sanction. So it was just, it's kind of frustrating because you can't stand there and explain and make up stuff. But other people had different things where they had to try and get their ID. Some were trying to find jobs. Some couldn't pay their rent, and so they lost their apartment and had to go into shelter. So there's a lot of fantastic real life scenarios. And this is something that we're going to bring to our community. We have the Fairgrounds book for Thursday, April 9 of 2026. And we will get some flyers out there. We're going to be looking for some community partners to help as volunteers during that simulation. We're also going to be looking for some community partners to help with the luncheon piece because we want to have lunch provided. We're going to have some guest speakers. So we're trying to make a good day of it from probably 8 a.m. until 2 p.m. But I'm excited to get that off the ground and moving forward because I think it's something people need to see and be part of again in the area.
Yes, I think that's excellent. Excellent. We used to, community reinvestment was something we need to bring back. So I think, as Corey mentioned, all the barriers that some of these people have to go through, you see why some of them eventually just give up and find out that they're not necessarily okay with what's going on in their lives, but they just gave up anyway. So we need to continually promote the ability of these people to actually improve their lives and help them as much as we can. And I appreciate all the group we have here and the way we share information and help everybody with their goals to go. Do we have any other questions or comments anybody wants to bring up?
I
just go ahead.
I just put in the chat, there's a similar activity that's partnership with the tribe. It's occurring the 10th of October, so very soon. It's the Missouri Poverty Simulator model, and it's coming to the fairgrounds this month. And so I've put the link and I shared the information with Corey, but it sounds similar to what Corey's got cooking for April. So if you want to get involved in that similar type of activity, it's coming right up.
Thank you, Thomas.
Thank you,
April was also chosen because that's Second Chance Act Month.
Okay, very good. Go ahead, Thomas. You have something?
I was just giving a thumbs up to Corey. That sounds great.
Oh, okay. Very good. Okay. And Corey sends out all of the information that we've covered on this entire meeting. She'll send it out in email, on the follow-up email. So everything that has come up today, we'll be able to see again and share. And like I said, the main focus of this committee is not only to give a lot of information out, but to share it with people who act on it afterwards. I appreciate everybody coming. Our next meeting is Tuesday, October 28th, the fourth Tuesday. And if nobody else has anything, and I don't see anybody raising their hand, I will adjourn the meeting. Thanks, everybody.
And thank you, Ken, for speaking today.
Yes.